Welcome to today's presentation on telehealth best practices for addiction professionals in private practice. My name is Michael O'Brien from addictionprivatepractice.com and author of Addiction Private Practice, the definitive guide for addiction counselors and therapists. I'm excited to guide you through the essentials of delivering effective telehealth services remotely. Whether you're just starting with telehealth or refining your process, I will cover valuable insights to ensure you're meeting both client needs and legal requirements. Plus, yes, another free form. You can download a free telehealth consent form for your practice on my website. Links for everything are in the article or description below. As always, I love to earn your likes and channel subscriptions, so if you enjoy this content, please hit the like button and subscribe to the channel. Let's get started. Before we get into the nuts and bolts of today's content, I'll provide you with a sneak peek of some content I'm going to publish soon. My 2 months of remote work from an island in Fiji. Yes, I did my entire private practice from this serene tropical paradise for 2 months. I flew into Fiji's mainland and took a 6-hour water ferry ride to this beautiful little island. Fiji has strong cellular service and 4G data throughout the islands, so I was easily able to do phone and video sessions. Telehealth adds amazing opportunities for self-care and mobility in this very rewarding career. Keep an eye out for more on this trip with lots of photos and stories. As telehealth becomes more common in the addiction treatment field, it's crucial to understand how to deliver the same high-quality care virtually. Today, we'll explore how you can optimize your telehealth services, maintain client trust, and stay compliant with legal and ethical guidelines. As you are probably already aware, addiction services and mental health services delivery via telehealth became radically accepted during the COVID pandemic. An increasing body of research is showing that telehealth is as effective as in-person services. In some cases, it may be even more effective. It used to be that providers who offered telehealth may not have as strong a practice as those with services only in a physical office. Now, the exact opposite is true. If you don't offer telehealth in your practice, your practice will likely suffer. Clients expect this as an option from providers, and it provides many advantages for you in your private practice. Telehealth offers numerous benefits for both clients and providers. It increases accessibility, making treatment available to clients in remote or underserved areas. If a client has disability or transportation issues, that isn't a problem with telehealth. Clients appreciate the flexibility, which helps reduce no-shows and improves attendance. Moreover, it allows you to continue providing essential services, regardless of travel restrictions or other barriers. In my practice alone, I saw no-shows go down significantly due to telehealth sessions. Let's dive into why these benefits are important for your private practice. When delivering telehealth services, legal and ethical compliance is key. You must ensure your sessions are HIPAA and 42 CFR. Part 2. Compliant to protect your client's privacy. This means using secure encrypted platforms like Microsoft Teams or Zoom that safeguard personal health information. Some EHR software platforms, like Simple Practice, which is one of my favorites, include a HIPAA-compliant telehealth component for free. I'll also introduce a free telehealth consent form, which you can download to ensure you're covering all necessary legal requirements with your clients. Depending on where you practice, the telehealth regulations can vary from very light to non-existent to much more complicated. Some states only require a telehealth consent form be in place. Other states require you to do specific tasks like confirming a client's location prior to the start of a session or asking them to stop driving their vehicle before starting a session. There may also be additional documentation standards. Check with your local certifying or licensing agency to find out what the specific requirements are in your jurisdiction. Just to be safe, the telehealth consent form I offer for free covers even the most complicated jurisdictions. To provide seamless telehealth services, you need the right tools, a stable internet connection. HIPAA compliant video platforms and good camera and sound equipment are essential. Equally important is creating a professional virtual environment. Good lighting and minimal distractions go a long way in making clients feel comfortable and engaged. Let's go over how to set up your space and tools effectively. All of the tools I recommend, including cameras and software, are located in the Tools tab of my website, addictionprivatepractice.com. You can visit the site and check them out. One of the most important considerations is if you are conducting sessions from your home, make sure that the space is private and confidential. No one should be able to hear your sessions. Your clients will become distracted, and so will you, if they can hear your dog barking or the neighborhood kids playing tag next door. Maintaining high-quality sessions in a virtual setting is not difficult, and following a few key best practices can help. Be prepared and ensure your client is too. Set clear expectations about the session format, minimize distractions, and maintain a structured session flow. Building rapport through a screen might feel different, but small adjustments, like making eye contact through the camera, can help maintain a personal connection. I highly recommend sending an email to clients a few days in advance of their first session that walks them through the process and gives them step-by-step instructions on how to connect with you. Encourage them to test their equipment and internet connection in advance. Always confirm their location in the event an emergency occurs and you need to support help. Make sure your client is not driving or potentially in harm's way if they become distracted. You'll be surprised how many clients pop onto their sessions with you behind the steering wheel of their vehicle. If they are parked for the session, that is fine, but driving is dangerous. One unique challenge of telehealth is handling emergencies. It's essential to have protocols in place. Always know your client's location at the start of each session and have emergency contacts readily available. Establish clear steps to follow if a crisis arises during the session, including when to call for emergency assistance or refer the client to local services. While emergencies are rare, you want to know exactly what you will do in the event a client becomes suicidal, a threat to themselves or others. You'll also want to know your steps if they experience a medical emergency while in the session. Be sure to have backup devices available in the event yours fail. A spare laptop, like an inexpensive Chromebook laptop, a phone and laptop charger, and an extra video camera. There are even backup intern connections available, like a data plan device from your mobile cellular company. One last thing to keep in mind, if a session suddenly drops or stops, don't panic. It is definitely unfortunate, but it isn't the end of the world. It happens. Your client will understand that sometimes all of our modern technology just does not work. If the technology failure is on your side of things, offer your client another session at no cost to prevent them feeling like they didn't receive the service they are paying for. Proper documentation is critical, even in a telehealth setting. Ensure your session notes are as thorough as they would be in person. Be sure to document that the session was via telehealth and whether it was phone or video. Document that the client was stationary and their location in your notes. If any unusual events or emergencies, properly document them. Most insurance providers now offer reimbursement for virtual services, but it's important to stay on top of any changes in billing policies to ensure you're maximizing your practice's revenue while providing clients with the best care. You will typically use the same CPT codes as in-person sessions, but add the telehealth modifier code to your super bills. Not sure what a super bill is? Be sure to check my website for a recent article on them. While telehealth is convenient, there are common challenges. Technical difficulties, lack of engagement, and confusion over legal compliance can create barriers, but these can be managed. Always have a backup plan for technology issues, and make sure your clients know what to do if they lose connection. To keep clients engaged, maintain clear communication and ask for feedback on their experience. Do you consider yourself to be a technologically challenged person? If so, ask a family member to do practice sessions with you using all of your technology. Schedule a fake appointment on your calendar, connect to the sessions, and go through the process as many times as you need to until you feel comfortable. As promised, I'm offering a free telehealth consent form you can download today. This form is designed to cover all legal and ethical considerations, ensuring that your telehealth services are compliant and your clients are well informed. You can download it at addictionprivatepractice.com and start using it in your practice right away. To wrap up, we've covered the essentials for delivering high quality telehealth services, from legal considerations and tools to handling emergencies and ensuring proper documentation. By implementing these best practices, you'll be able to offer the same level of care remotely as you would in person. Don't forget to download the free telehealth consent form to further support your practice. Thank you for joining me today, and I wish you success in your telehealth journey. I hope to see that you are practicing from some remote tropical location soon. Stay in touch.